Question number 1. Which of the following is the most basic human need according to Maslow hierarchy? The right option is option D, psychological needs. Question number 2. When assisting a patient with hygiene needs, the nurse should first. The right option is option B, provide privacy and explain the procedure. Question number 3. A patient is complaining of hunger and has not eaten all day. What type of need is the nurse addressing by offering food? The right option is option A, physical need. Question number 4. How often should oral care be provided to an unconscious patient? The right option is option B, every 2 hours. Question number 5. Which of the following is a sign of adequate hydration in a patient? The right option is option D, skin turgor is normal. Question number 6. When promoting sleep for a hospitalized patient, the nurse should avoid. The right option is option A, giving caffeine in the evening. Question number 7. The nurse is helping a patient meet the needs for elimination. Which of the following is a correct nursing action? The right option is option C, providing privacy during urination. Question number 8. A bedridden patient is at risk of pressure sores. What is the most appropriate nursing intervention? The right option is option C, use pillows to relieve pressure. Question number 9. Which nutrient is most essential for tissue repair? The right option is option D, proteins. Question number 10. Which is a correct nursing action while feeding a dysphagic patient? The right option is option A, feed while the patient is sitting upright. Question number 11. Which intervention best support a patient's spiritual needs? The right option is option B, arranging a visit from a religious leader. Question number 12. What is the most important safety measure during a bed bath? The right option is option C, raise the side rails. Question number 13. The nurse observes that a patient is not sleeping well. What should be the nurse's first action? The right option is option C, assess for reasons of disturbed sleep. Question number 14. What is a sign that a patient is experiencing dehydration? The right option is option D, confusion and dry lips. Question number 15. A nurse is preparing to assist a patient with toileting. Which should be done first? The right option is option A, lock the bed wheels. Question number 16. Which nutrient helps in strengthening bones? The right option is option C, vitamin D. Question number 17. The best time to weight a patient for accurate body weight assessment is? The right option is option D, in the morning before eating. Question number 18. The nurse observes that the patient urine is dark and concentrated. What is the likely cause? The right option is option C, dehydration. Question number 19. The most effective method to prevent pressure ulcer in an immobile patient is? The right option is option B, frequent position changes. Question number 20. A patient with restricted mobility must be encouraged to? The right option is option A, perform passive range of motion exercises. Question number 21. What is the most essential factor to ensure while providing a patient with nutrition? The right option is option D, the patient is sitting upright. Question number 22. The nurse assists a patient in brushing their teeth. This is an example of? The right option is option D, basic nursing care. Question number 23. Which vitamin is most essential for wound healing? The right option is option B, vitamin C. Question number 24. The main goal of providing emotional support to a patient is to? The right option is option A, promote comfort and reduce anxiety. Question number 25. Which of the following indicates a risk of malnutrition? The right option is option D, recent weight loss and fatigue. Question number 26. The nurse finds the patient bed linen, wet and soiled. What is the best nursing action? The right option is option B, change the linen immediately. Question number 27. Which of the following actions promotes the psychosocial well-being of a patient? The right option is option A, providing privacy and listening. Question number 28. Which sign suggests that a patient is experiencing sleep deprivation? The right option is option C, irritability and confusion. Question number 29. When giving a bed bath, which area should be cleaned last? The right option is option D, perineal area. Question number 30. What is the correct method to check skin turgor? The right option is option C, pinch the back of the hand. Question number 31. The main goal of rehabilitation is to? The right option is option B, help the patient live independently. Question number 32. A nurse encourages a bedridden patient to do deep breathing exercises. What is the first benefit? The right option is option B, prevents lung complications. Question number 33. A nurse is feeding a semi-conscious patient. What is the safest action? The right option is option A, feed in side-lying position. Question number 34. How should the nurse measure a patient fluid output? The right option is option C, measure urine in a calibrated container. Question number 35. The most basic comfort measure for a febrile patient is. The right option is option C, giving tepid sponge bath. Question number 36. Which one of the following promotes rest in a hospitalized patient? The right option is option A, quiet surroundings. Question number 37. The most important reason for encouraging fluid in a patient is. The right option is option C, to maintain hydration. Question number 38. A patient with limited mobility should be monitored for. The right option is option B, edema and skin breakdown. Question number 39. What is a priority when assisting a patient with feeding who has a risk of aspiration? The right option is option D, monitor for coughing and choking. Question number 40. What does the abbreviation ADL stands for in a patient care? The right option is option A, activities of daily living. Question number 41. Which action best prevents the spread of infection during patient care? The right option is option D, performing hand hygiene before and after care. Question number 42. To prevent foot drop in a bedridden patient, the nurse should. The right option is option A, use footboards or positioning devices. Question number 43. What should a nurse monitor to evaluate a patient's nutritional status? The right option is option B, body weight and dietary intake. Question number 44. Which is the best time for the nurse to assess the patient's sleep pattern? The right option is option D, during health history interview. Question number 45. A nurse is providing mouth care for a comatose patient. What is the correct position? The right option is option D, side lying. Question number 46. Constipation in bedridden patients can best be prevented by. The right option is option C, encouraging a high fiber diet and fluids. Question number 47. A patient with urinary incontinence should be. The right option is option A, provided with frequent toileting and skin care. Question number 48. What is a common complication due to immobility? The right option is option B, pressure ulcer. Question number 49. A patient refuses to eat hospital food. What should the nurse do first? The right option is option C, ask the reason for refusal. Question number 50. What is the first nursing action when a patient complains of pain? The right option is option A, assess the pain level and location.